Hi, I'm Dr. Bruce Sands, Chief of the Dr. Henry D. Janowitz Division of Gastroenterology at Mount Sinai Hospital, and I'd like to invite you to the 4th Annual Live Medical Crossfire IBS and IBD. This two-day virtual interactive conference will take place February 24th through February 25th. We'll provide you with expert insights on the latest emerging therapies for IBD, colorectal cancer surveillance in patients with IBD, and digital therapeutics. At this year's live medical crossfire IBS and IBD, we're going to be focusing on some really important topics. We'll be talking about best practices in IBD diagnosis. More importantly, we have 3 new approved therapies for the treatment of IBD in the last year and a half. So it's time to talk about those therapies, how they work, what their efficacy is, what their safety is, and very importantly, how to position them in the care of your IBD patients. Always a challenging issue is knowing when to stop a therapy and move on or to change a treatment. Always a challenge in the care of a patient, and we'll have some interesting discussion about that. Another thing that all of us find challenging is the management of extraintestinal manifestations in our patients with IBD. So we'll have another focused talk on that issue, and then a debate on colorectal cancer surveillance in patients with IBD. There's a lot of discussion nowadays about what that approach actually should entail, and practices do vary across the world. And finally, many of us are challenged with patients with IBD who have a cancer already and need treatment still for their IBD. So how do we actually go about managing those patients? So I think these are going to be really important and beneficial topics that you're going to see covered this year. And I'm very excited as well about joint discussions about overlap between IBS and IBD and what we can learn about that. So join me and world-renowned faculty as we discuss advancements in this rapidly changing field while offering the ability to network with top minds.